Pat Gavin, CEO of Hunterdon Healthcare, here with our weekly COVID-19 update. Today, I thought I would share where we're at in the hospital, as we always do. So, first of all, we're really pleased to announce that we have 115 inpatients and 68 emergency department patients who have been successfully discharged and are recovering from COVID-19 at home. In addition, 14 patients with COVID-19 have been successfully removed from ventilators and are breathing on their own. So that really excites us all in the hospital. To celebrate our patients' discharges, we've created a wall on the first floor of the hospital where each of those patients is represented with a Hunterdon heart. And you'll see a picture of that in the video. We also, as of Tuesday, started to play a little tune throughout the hospital that represents each time that we discharge a patient to home that has COVID-19. So we are starting to be able to celebrate some of the successes that have been throughout the COVID pandemic. So as of 10:30 a.m. today, April 22nd, hospital census is a little higher than it's been in the past. It's 135. 45 of those patients have been diagnosed with COVID-19. 9 more are still rolling in or rolling out. We have 10 patients in the ED, and 3 of those patients are being ruled in or out for COVID-19. No one in the ED at that time had COVID-19. In our outpatient respiratory illness sites and our respiratory illness tent at the hospital, 919 COVID-19 tests have been performed. 288 patients have been diagnosed with COVID-19, and 37 patients are waiting for COVID-19 test results. This week, we began sharing daily stats on our Hunterdon Healthcare website and social media pages. I encourage you to like, follow, and visit those. Please also help us with sharing the information with your family, friends, and neighbors. To our patients who are recovering from COVID-19, I hope that you're resting and feeling better each day. And for you, as someone who has recovered from a COVID-19 infection, there are ways that you can help save the life of someone else who has the disease. There is evidence that a blood donation from someone who has recovered from the illness, called convalescent plasma, can help a person sickened by COVID-19. If you would like to become a donor and meet the criteria listed on the screen, please call the Miller Keystone Blood Donation Bank, and the numbers and information for that will appear on the screen for you. As we all know, if we must leave our homes, wearing a face mask is now required. Today, Chris Hunt, Administrative Director of Safety and Security for Hunterdon Healthcare, will provide an overview of donning and doffing, or taking off and putting on the mask for those of you at home. There are proper methodologies that will keep you from contaminating your hands or your face, so it is an important video to watch.
Okay, so I'm going to talk to you today about how to properly wear a mask, whether it's a homemade mask or a mask that you buy in a store. The important things is once you put the mask on, you want to make sure that you get a good fit. And so what you need to do first is you're going to put it on. Whether the straps go over your head or over your ears, you're going to make sure that they're on. And then you want to have it snug to where it goes under your chin and over the top of your nose, and it's snug against the face as best it can be. When you have the mask on, the most area considered to be the most contaminated is the front of the mask, so you never want to touch it. Really hard to do is not to touch the front of the mask. It's easy to find yourself touching it, and so if you do that, you need to be aware, and then just wash your hands with soap and water with hand sanitizer if you do touch it. If you do need to make adjustments to the mask, 2 things. First, wash your hands again, because you're going to be touching your face, and so you want to make sure your hands are clean. And then if you have to make an adjustment, you can pull it back down underneath and then wash your hands again, and you're good to go. If you can make adjustments from the sides, from the ear straps, it's always safer to do that, and do that from the straps themselves to make an adjustment on the mask. But again, always wash your hands before and after any time you touch it. When you're out in public, one of the things that we see people doing often is they'll take the mask and they'll lower it so that part of the mask is like this, and they bring their nose out. The problem with that is that when you have this part of the mask underneath your nose, it's easier for you to inhale and breathe in all the things that were trapped on the front of the mask. And so you want to make sure not to do that. So if you're going to take the mask off for any reason, to readjust or whatever, or to talk to somebody that needs to read lips, is one of the issues that we're seeing, why people take their mask and move it and adjust it. You don't want to put it under your chin. You don't want to put it under your nose. You want to take it completely off if you need to do that. And then go ahead and put it back on. Again, once you've got it put back on, you want to make sure your hands are always clean every time you do that. Another thing that we see people doing is they'll take the mask and they'll have it hanging off their ear and they'll walk around like this, or they'll have it where it's completely under the chin. Again, these are things where you can inhale. You can inhale those things, or the mask can actually come off and wind up on the ground. So again, if you do take it off, don't leave it hanging on your face, don't leave it on top of your head. You want to take it completely off. And then again, when you go to put it back on, make sure that you're washing your hands. And you always want to make sure that you have one side that you know is the side that goes to the face, and one side that always goes to the outside. So the homemade masks are good because you can wash them. So it just goes in the regular wash like you wash anything else, and then you'll be able to reuse it again after. A regular mask that you buy somewhere, those don't have that same capability, so you use them until they're either soiled, too dirty to be used, or falling apart. Obviously, you need to replace it. Other things that I wanted to point out about just wearing the mask and out in public is you don't want to share your mask with another family member. So if you wore it today and then someone else needs a mask later on in the afternoon and you haven't washed it, you shouldn't give them your mask to use. They should have their own. If they do need to wear the same mask again, it needs to be cleaned between uses, and everybody should kind of have their own. So that's kind of the basics about the mask and wearing them out in public. Our goal here is to make sure that you keep yourself safe, you stay healthy, and you take care of yourselves. Thank you.
Thank you, Chris. On behalf of Hunterdon Healthcare, I want to thank you for joining us today, and want to again thank all of our staff who continue to do an amazing job as the pandemic continues. It has changed over time, but it does continue. Our numbers are actually higher in the hospital, but not necessarily more infections. With that said, thank you all, and we look forward to good health for our entire community.